I see a hand already. Yes? Okay. Please wait for the microphone to start your question.
If in the autoimmune reactivity, with autoimmune reactivity, where let's say you're testing for foods, wouldn't that change periodically? How often? I mean, somebody could be reactive to carrots, and then maybe in 3-4 weeks, maybe they wouldn't be reactive to carrots and reactive to something else.
Do you understand the question? The food immune reactivity question is because it's changing from day to day and all of that. In my opinion, food immune reactivity may change every 2 weeks, 3 weeks, something like that. But if you have high levels of antibodies against the major foods, for example, gluten, dairy, potatoes, if it's 5+, we'll stay there for years. It's not going to change. Those are the kind of things I have concern about. The laboratories which you think the result changes because they don't do a reliable test in the first place. Sometimes, like in some laboratories, they send from the same person 2 different bloods, okay? And then they send 2 different results. And so that's why I'm talking, it has to be done by a reliable test, a reliable laboratory.
Okay.
And therefore, those will be stable.
One more question. With all the sport bottles they have now that are plastic, but they're BPA free and they're the harder, thicker plastic, are those safe for water, or are those also?
Okay, the next question is very, very important. Because when bisphenol A, somehow they changed the bisphenol A, they came out with the BPA free plastic. Ask yourself, how do they make plastic? The issue is not BPA only. Any plastic is bad for you and me. So BPA free, 10 years from now, they will tell us it's bad for you. But I can assure you right now that I tell you that it's not good.
I have 2 questions, actually. And one of them you may have at least partially addressed at the beginning when I wasn't here, and I apologize for that.
Please.
The 2 questions I have, the first one, is it quite possible that what people are now calling Alzheimer's, dementia in general, might in fact be more these food reactivity neural problems than they are actually true legitimate dementia produced by the syndrome of an Alzheimer's kind of thing? That's one question.
Let me answer that first.
Fine.
And then we'll do the second one, no problem. Okay, if we look at the 3 factors, because we don't have more than those 3 factors. Of course, I don't want to talk about the stress and all of that. I'm talking about the 3 environmental factors. Toxic chemicals, infection, and dietary proteins and peptides. Which one of them you think is more damaging to neurons? Thank you so much. Toxic chemicals. But toxic chemicals could be in the food also, right? So we know aluminum already, that there is evidence, so far we had evidence, that it goes to muscle, stays in the muscle for years. It goes to the brain, stays in the brain for years. The last article which I read in Journal of Mucosal Immunology, which we immunologists only read that, show that 40% of aluminum goes into epithelial cells in the gut and stays there. Isn't that a cause of opening up the tight junctions? When the tight junctions are open now, toxins are released, open the blood-brain barrier, damage to the neurons. So everything is connected to each other. But which one of these 3 factors are the most contributing? Toxic chemicals is number 1, damaging to the neurons, and therefore Parkinson's and Alzheimer's and all of that. I don't know, you remember the very special case of that young individuals who were using drugs, and the drug was contaminated with MTB, some, it's a very long name of chemical, and next day, all of them developed Alzheimer's-like syndrome, and since then, they're using that for studying Alzheimer's. So chemicals are more damaging to the neurons, causing Alzheimer's and Parkinson's, but some foods, such as gluten and dairy, maybe other foods like aquaporins, also could be damaging. Some infectious agents, such as herpes type 6, Epstein-Barr virus, cytomegalovirus, also could be damaging. Oral bacteria could be damaging to the neurons. She has the second question. Thank you. Go ahead.
This is the one I probably missed at the beginning. But I recently sat on a wonderful lecture on the human biome, microbiome, and I'm wondering if, in many instances, some of these, the lack of having the oral, I, for example, was cesarean, and the lack of having the oral inoculation at birth and going through the vaginal canal, breast milk, and all that, how effective would a fecal inoculation be to reestablish a better system at large?
Okay. Yeah. I'm going to be grandfather in about 2 weeks. Every day we are waiting. My daughter is going to have her first baby, and this is first grandchild. And we were debating, and the doctors were trying to impose on her, first of all, to be immunized during pregnancy for flu and others. And also, during the first day in the hospital, hepatitis B, first month hepatitis B, second month hepatitis B. So all of those are really damaging. We have to learn to say no. So I had to teach my daughter to say no to her doctor. And she had to opt out also from all of that. I hope she will have natural birth, because C-section, when child is not exposed to good bacteria of the mother, which is the first bacteria activating the immune system to activate the Treg cells and inducing tolerance. If you have C-section, I wanted, and this is an idea for those who are in business, I wanted, if I really wanted to start a business today, I was going to make a cream with a mixture of lactobacilli, bifidobacteria and everything from 5 or 10 different companies. And every mother which is going to have a baby, put a little bit of that on the nipple and then do breastfeeding. If not, make it in the form of drops and give upon birth, just a couple drops every day to that baby. Believe me, you are going to change the course of human health by just doing that.
And what about doing a fecal transfer of some sort?
Can you ask that question again, please?
The fecal transplant you were
Right,
talking about?
right.
We talked about that. Yes, it's working.
I think that's good.
Yeah, absolutely, it's good.
Safe? Is it safe?
Definitely. That's why some people think about safe or no safe. That's why getting it from their partners, which you guys didn't like it. Yeah. Okay, next.
This question sort of ties into the whole inoculation and immunization. With a child that is already exhibiting autoimmune reactivity to certain foods, I would imagine that the vaccination schedule that's in place right now would probably not be something that would be a good idea.
100% I agree with you.
Okay.
200% I agree with you.
Great. Okay. Especially in terms of aluminum and other types of heavy metals that we know are in these vaccines.
Yeah.
I don't know if everybody's familiar, but right now there's a SB 277 bill which is trying to mandate vaccines in the state of California. So
please be aware.
Please call your senators and let them know.
Thank you. We
and
want you to be one of those to help us with that.
yes, I've been doing that quite a bit.
Thank you so much.
Another question I quickly had for you was regarding the autoimmunity piece. If somebody has gone into autoimmune disease, do you see that actually being something that they potentially could also come out of, provided the mechanism has been slowed down?
We should not be pessimistic, okay? You know, my presentation was about stage 1, 2, and 3, and stage 3 we cannot do much unless we just prevent the worsening of the conditions. But I have seen, when you find the right trigger and you remove that trigger, sometimes the body is victorious, can repair itself. And so therefore it is possible, yes.
Thank you so much.
Thank you.
Also regarding C-section, I do believe that they're doing vaginal swabs now for C-section babies. So essentially they're taking a swab in the vaginal canal and wiping it on the cheek of the child to try to help to create some type of bacterial.
Who's doing that? That's fantastic.
Certain hospitals actually that are starting to use that procedure. Whether it's effective or not, or same as vaginal birth, we have yet to see, but just
That's
FYI.
a fantastic piece of information. Thanks a lot.
What can you tell us about female puberty and in puberty in females, and then autoimmune disease? And have you seen a correlation? Because I've read studies and I've been reading, of course, some of it relevant to my own family, but puberty onset and bringing on some...
What age?
Anywhere between 12 to 14.
Well, we are talking about the role of hormones in autoimmunity. There is a significant amount of literature about the role of hormones. Some of them are preventive, some of them are protective, some of them are damaging, and that's why the difference between male versus female, that we have more autoimmune disease, because there are receptors for estrogen and many lymphocytes which are involved in autoimmunity. And so there is a lot of literature about that, but you know, about puberty, I think we can blame everything on the hormones. Like everything else.
In a follow-up to that question, so a lot of what we're seeing, well, as a clinician, I'm seeing a lot of women, I go into their past medical history and I find when did you start puberty? They're saying 9, 10 years old. So with the greater exposure of estrogens, is there in general, a greater susceptibility to autoimmunity?
Okay. First of all, let's ask the question. That's fantastic. Thank you so much, Douglas. Why these days our kids are getting, their cycle at age 9? Why is that? I really want you to think about this. You are visionaries. Thank you so much. So that's more has to do with autoimmunity than the natural hormones. So that's why the healthy diet, the healthy whatever that I mentioned tonight is playing such a role in overall health of our families, including our children.
So you have a panel that looks at, Aristo, over here. We have a panel that looks at reactions to different foods. I'm curious, for people that take supplements on an ongoing basis, vitamin D and all those things, if you were to create a panel to look at immune reaction to various supplements that people are taking every day, what do you predict the result would be?
Okay. You can measure antibodies against antigens. Antigens are large molecules that like the size of 20,000, 50,000, 100,000, 500,000. You can detect antibodies. For chemicals, including vitamins, you have to bind them to a carrier such as hemoglobin, albumin, and then you measure antibody against the combination of the two. Okay? So if I will bind it to human serum albumin, let's say, for the sake of argument, I'll take vitamin A and bind it to human serum albumin and measure antibodies, and I'll say that you have antibodies against vitamin E. Is that really what I'm measuring? That vitamin E bound to protein is completely different now. I'm measuring antibodies against vitamin E bound to human tissue, which I don't think it's happening under normal conditions. Under normal conditions, formaldehyde binds to our tissue. Under normal conditions, aflatoxin can bind to our albumin. But I don't think vitamins will do that.
Okay, thanks. And then you mentioned when Treg cells go up, that transforming growth factor also goes up.
Yes.
I know there's some practitioners that look at TGF-beta1, and when it's elevated, they use things like losartan and others to reduce it. And so I'm curious, I mean, that seems counterintuitive.
I think that's not a good idea.
Okay.
Because Treg cells produce TGF-beta and IL-10 together. And those two together regulate the immune system.
And so at any level, you would
They
say
are
that it's still a...
anti-inflammatory.
Right,
Those
okay.
two cytokines are anti-inflammatory. I'm not anymore talking about Th1, Th2. I'm talking about inflammatory versus anti-inflammatory cytokines.
Great, thank
and
you.
TGF-beta and IL-10 are anti-inflammatory.
So on the mice experiment, you talked about the fecal transplant and the change in the behavior. Was there any measurement in the elements of the one mice versus the other one as far as like the floral bacterial measurement or anything? Was there any?
There are many, many other experiments in there. I just showed one. And additional experiments, for example, they took Campylobacter jejuni. They just added Campylobacter jejuni to the drinking water and then watched the mice. The mice before Campylobacter jejuni or regular water, they were playing like crazy, going through the maze and everything. After Campylobacter jejuni, they could not find their way and just stuck in one area. So there are many, many more experiments in there.
And then as far as your Lyme disease test goes, how about accuracy? Because that's always the factor in Lyme testing.
Okay. Our laboratory is approved by the College of American Pathologists. You know, that not many labs can get to that level. And every 3 months, we get 5 specimens that lined specimens. And we get the score always 100%. And so we detect about 25% more based on our test that other laboratories are not going to detect them. Also, let me add to that, there are lots of false positive test results associated with Lyme disease. I'm in the process of writing this article. Hopefully we'll publish it within a year, that if you have antibodies against certain food, cross-react with Lyme disease in Western blot. If you have antibodies against Epstein-Barr virus, you can get cross-reaction with Lyme and you get false positive. So really this whole world of Lyme is crazy world, and you get from one hand false positive, from other hand you get false negative. So you have to be aware of all of that. And that's why recently, in fact, practitioners who listen to me, to my talks, they are ordering actually, every time they order Lyme disease, they order Epstein-Barr virus as well.
Shouldn't we also be ordering the HLA test that measures the genetic propensity for having problems with chemicals, with molds, and with Lyme, and the combination?
Can you tell us, because I really am not familiar with that type of HLA. I'm familiar with HLA and autoimmune diseases. Okay.
DR. It's HLA-DR. Is that correct?
DR what? Because I know, for example, DR3, DR1, DR4 is associated with all kinds of autoimmune diseases.
You know, I can't answer it more specifically at the moment, but it's a test that Richie Shoemaker used, and my shorthand way of explaining the test is if you need a kidney, they would use this test on you, and to see if your genetics match. And he actually rewrote this test so that it has...
Depends. Okay, depends. in my opinion, depends what percentage of population carrying that gene. Example, HLA-DQ2, DQ8 in celiac disease is found in about 50% of the population. Okay? So by just doing the test, how much the test is going to help me?
Well, I found in my...
Because those who do not have HLA-DQ2, DQ8 also can get celiac disease and non-celiac gluten sensitivity as well. So I don't think how accurate is that HLA typing for chemical sensitivity.
Okay, just one comment, and that is that you know, I've had Lyme disease since 1988, and I did not treat it with antibiotics because I have mold sensitivity issues, and the system becomes very moldy when you take a lot of antibiotics. So actually, I have virtually no symptoms today, and I'm sure it's because I didn't treat it that way. And it was because of that test that I made that decision not to do that. So I'm just wondering. How were you
diagnosed? I'm sorry, I'm asking because.
I'm sorry?
You said that you had Lyme disease and you did not treat it with
Western blot, with the Western blot.
Okay, so that's proof.
Yeah.
Yeah, that's proof that you had. So how did you treat that? Because we want to learn from you.
Based on Stephen Buhner's book, I actually treated with Polygonum caspididum to suppress MMP9 cytokines. And that seemed to be effective because the Lyme likes to eat cytokines to multiply. So if I took its diet away, it was happy, it was unhappy, and it subsided. Anyway, that was me.
Thank you
but that's why I'm wondering, you know, it seems to me if you have this test and then you look at the genetic propensity to have a problem with those particular items, this would be very helpful in making a determination.
Okay. If really there is evidence that HLA-DR 90% correlating with chemical sensitivity. Okay.
So,
please.
I need help picking out a probiotic. So right now I'm thinking of Saccharomyces boulardii. How do I know if that's going to make me timid and shy or courageous and playful?
No, first you have to ask this question. You ask, how do they measure shyness in a mouse? And then in you. I know that probiotics work. The Saccharomyces boulardii, there are many articles published in scientific journals. They work fantastic. Sometimes taking combination of different probiotics with Saccharomyces boulardii will be the best treatment for prevention of shyness.
What's your opinion on colonics and its role to help clean the gut out when you've got leaky gut or candida?
First of all, let me admit that I did colonic. Okay, so therefore, that is telling me that we have to do it from time to time, but not to exaggerate, because if you do it too much, also, you are going to remove the good bacteria. When I did my colonic, I took with me a lot of probiotics, and I asked them to put that back, and I think that will be the best way to do it.
Due to time, we're going to have to end. And I want to thank everyone here and everyone who's attended via live streaming to just look over this again, because this has been an excellent presentation with a lot of great information. And thank you for all being here and coming. And thank you very much, Dr. Vojdani.
Just a couple words I would like to add. I thank you for your participation. I wasn't going to be here if Susan Downs, was not, actually was at F4M, right? She came to me and said, Ari, you have to come. You have to come to our group. And thank you for inviting me, because meeting intelligent people like you is a blessing for me. Thank you so much.